Let's take you straight to KZN now. The public sector wage strike continuing to disrupt the running of essential services like hospitals and courts. Nahau is demanding a 10% hike for its members. Nqobile Madlala is monitoring the situation in the Pietermaritzburg area, and this is day 3. Nqobile, you've moved around quite a bit this morning. Give us a sense of what you've been seeing.
Well, from what we've seen, Marcel, Northdale is already not working, and Northdale Hospital is basically one of those hospitals that services quite a number of people. Grace Hospital is one of the hospitals also that we visited, and this is the same hospital that we've come to see here. Now, you may see just a small crowd here of people that are standing in front of the gate, but this is one of the entrances at Grace Hospital. The main entrance has thousands and thousands of people that are standing outside. We saw this from yesterday, and it continues so today. You can see already there are tires that are burnt. So even if you wanted to go and work, it's almost impossible for you to go inside because you have no choice but to stand outside. So quite a lot of people that are nurses and that are supposed to be in the hospital are parked outside. Others are already in their cars and they're just parked and waiting. But you will remember that even though this is a house strike, and we know that they are the ones that have decided that they want the 10% and that they will remain resolute, there are other members that are falling under other unions that may not agree. So I'm going to bring in PSA now to speak to us, because some of your members, of course, are expected to be at work and they're expected to do their work. Tell me, have they been able to do their work?
The first thing that we need to put to perspective is that PSA was the first union to go on the strike because we rejected that particular 3%. You will recall that government in 2021 give the public servants the 1,000 rand, which they are going to stop giving the public servants. Then we took a decision as PSA to say we need to ensure that the public servants have something in April. Hence, we went on negotiation. We have placed our demand of 10%. And it's important for us as PSA to put the record straight to say what is happening currently is because of the arrogance of government who try to divide the working class. But on record, PSA is not on strike. Our members are unable to access many of the workplace. We find that some of the institutions have been forcefully removed. Our concern in the province, the silence of the DG, the silence of the Prim and some of the executive, they have no clue. There is no communication. How do you expect members to report for duty? It is for these reasons that PSA has been saying protect collective bargaining so that you can be able to prevent some of these particular issues. Many of the hospitals are dysfunctional, so we are saying if they don't want to respect us and give that 10%, they will create some of these particular issues. As PSA, we are not confused. We'll never be on the side of government. We are on the side of the employee. We understand the workers struggling. It is not our duty to attack other unions. They are not our enemy. But what we appeal to those people that are on strike, let's respect the law. As PSA, we are the law-binding citizen. That's why on the 10th of November, we went on the street. Those essential services were unable to join us, so we accepted that. But Thulas Nqesi is very arrogant. He created a mess in the public service. So as PSA, members must be aware. We are on the negotiation. We hope that government will come with a better offer, because we don't expect government to give employee less than 6.5 or less than 10%. Our demand is 10% and other demand. So we want those demands because our employees cannot be able to go hunger. They must make sure that they've got something in their pocket. We are not afraid. We are saying to government, listen to the working class, protect the collective bargaining.
And I mean, we do know that you're not just the only organization that has, the union that has already said that the MEC has been very quiet in the Department of Health, that the DG as well as the HOD has been very quiet. Tell me, have you tried to contact them and sort of gauge where are they standing? Because if there's so many hospitals that are not working, how many more people need assistance that have not received?
So we are saying we have engaged with some of the MECs, we have engaged with some of the HOD. There is no agents in terms of protecting the workers and also allow engagement, because we are saying there is no union that is the enemy of the PSA. But the current crisis that we have, it's a lack of communications. If you're not communicating to our own employees, you don't expect our employees to report for duty when other unions are on strike. You don't expect our employees, some of them are intimidating them. They said there will be no work, no pay. So we need to able to get that particular assistance. But the message is very clear. We are saying government must stop undermining the working class, must stop undermining the public servants. So we are saying give the public servants what they deserve. Do not divide the working class. We so wish that when we started the strike last year, many of other sisters union joined us, because this is not about individuals union. It is about the workers struggling. It is about the demand of the workers. Workers are suffering. As PSA, we are on the ground to ensure that the members get first-hand information, to ensure that we communicate to our members, like in water and sanitation in Durban, the police have fired some tear gas to dispense some of the people, even some of the people who are not on strike. So we need political leadership. The Prim of KwaZulu-Natal must say something. The executive must be able to say something. Engaged organized labor, so that you can be able to have solutions. Because if they undermine collective bargaining, they continue to incite us with less than inflation's increment. You'll continue to have these challenges because government have created this. So as PSA, we are a law-abiding trade union. We believe in the principle of law and said the law must take its hands, but we're not afraid of government. Hence, we're waiting for government to respond on our demand. There is no worker that can be able to leave. They gave us in 2021 1.5%. Last year, they gave us 3%. They imposed that 3%. We are saying the public servants are suffering. So if they don't want to listen to that, I'm afraid that this country will collapse. It's that for this reason to say we need communications. But as PSA, we will go on the ground and support our members. We are not on the side of the employer. We must clarify that we have not accepted anything for the employer, but we went on the negotiation to ensure that come April, if they deduct this 1,000 rand cash gratuity, they've got something. We care for the workers. We care for their job security. That's why when we went on the strike, we follow all the law. We've got all the legal aspects that is able to guide us.
But at this point, I mean, you must understand that there are people that need these services that are not being able to access these services, just like your workers. So what happens to those people? What is PSA saying about the people that are seeking services in these hospitals, in these various other areas?
Remember, when our spokesperson, Mr. Nqobile Madlala, warned the government to say, if you don't go back to the wage negotiations, the public will be affected. They warn them, if you don't listen, you continue to insult us and say, Sibazami, the public servants will be affected. But the communities must stand up and support the cause of workers, because people are dying. Most of these people don't have medical aid. But what do you do when you create a division? That's why as PSA, we went to the negotiation and put our demand, because we're not afraid of government. We say, deal with this issue. We want to see the political leadership in the province. Where are the executive? They must be on the ground and be able to mitigate against the current situation. I can tell many of our members are afraid to report for duty. Do you want them to go and report if there are more incidents? But what we are appealing to those that are in strike, let's not fight with the workers. We are not the enemy. The enemy is government. Government must listen to us. They used to listen to us when we put our demand. It's not only hospital. In Durban, licensed department staff were moved out in some of the departments. So which means we are affected. But what we are saying, the enemy, we don't have an enemy amongst union. We say they've attacked collective bargaining. This is the result that I've seen. PSA have over 102 years experience in dealing with these issues. We say government, take us serious when you negotiate. Remember when you went out in negotiation, people said PSA don't want to negotiate. We're giving them a signal. So they must expect, they must come with a better offer.
So does that mean that we can expect PSA to join then if the government doesn't listen?
Remember, we are on the negotiation. We always want to respect the process of collective bargaining. We have tabled our offer for our demand for 2023 to 2024. We said, government, give us 10%. Government, give us 1, 2, and 3. Government must come to their sense and think about us. It is for this reason and say, members must not be confused. PSA is in support of workers. We are in the negotiation to support you, ensure that come April, you've got something in your pocket. We protect your job security. PSA is the union of choice.
All right. Thank you very much for speaking to us. That's Nqobile from PSA. But Marcel, as you can hear, some of the members cannot come in because they are also scared. Some of them have been intimidated. But what we understand is that even though PSA says that they are on the side of the workers, they are still feeling like Nahal that they are not heard by the government. But also just a touch there talking about the lack of leadership, saying that there's no political leadership that's willing to talk to them and speak to these issues that are faced by the workers. Ourselves have reached out to the Department of Health. We reached out to them yesterday. We tried to get that interview with the MEC or the HOD or anyone who's willing to engage us. We didn't get that interview. We still haven't received anything saying whether or not the Department of Health will explain to us if hospitals are closed like this, what does that mean for anyone who needs assistance?